What is object relations theory and how does it relate to borderline personality disorder? So, what is object relations theory? Well, Melanie Klein created the object relations theory that suggested infant relationships to objects, aka people and experiences with people, would ultimately dictate the future relationships and attachment style. She believed that negative relationships at a young age would deeply impact their future. I'm going to dive a little deeper into this article right here. Object relations theory is all about understanding how we internalize our early childhood attachments and how those beliefs later affect our relationships. And while the term may make you think of an inanimate object, it actually is referring to significant people in our lives. There are two primary types of objects in this theory: internal objects and external objects. An external object is an actual person or thing that someone invests their emotional energy into. A whole object is a person as they actually exist, with all the positive and negative traits they embody. Internal objects are our psychological and emotional impression of a person. It's the representation we hold on to when the person isn't physically there. And it also influences how we see this person in real life. An object constancy is the ability to recognize that objects do not change simply because we don't see them. Infants begin to learn object constancy when their parents leave for a short time and then return. Severe anxiety and fear of abandonment are common in people who have not successfully developed a sense of object constancy. Whole object relations. Another important concept in object relations theory is the idea of whole object relations. This idea suggests that people can view people as an integrated and stable whole. This includes both the positive and negative qualities of a person. And a person lacking whole object relations may hold a split view of other people. This person may see others as either all good or all bad, depending on how they relate to them in a given moment. And this is the phenomenon commonly known as splitting, which tends to be common in people with borderline personality disorder, like myself. While the causes of BPD are complex, it has been linked to negative childhood experiences, including abuse, trauma, neglect, and abandonment. Other research has found that object relations are predictive of BPD symptoms. And according to object relations theory, it is crucial the way that mothers and infants interact as it impacts the infant growth and development. If the care is good enough, the child will develop into their true selves. If it is not, or inadequate, children create a false self, or one that is playing into the needs of others and is based on compliance with others' expectations instead of the child's authentic self. And also in this article, it does clarify that the idea did not originate with Melanie Klein. It's actually an idea from Freud. And this theory can even be used as an approach in therapy for people to understand how childhood relationships may influence their interactions in adult relationships. For example, a therapist might work to explore some faulty beliefs that may have formed due to poor connections with caregivers in infancy and childhood. People can work to replace these ideas with healthier expectations for how interpersonal and romantic relationships should work. And object relationships theory sometimes is used even to treat phobias, particularly those that focus on our relationships with people. And just remember, knowledge is always power. The more you know and the more you understand about yourself, the more empowered you become.